Today we have inaugurated a cancer conference on lung cancer, awareness of lung cancer, how to diagnose lung cancer early stages, how to treat, and what are the advances in the treatment of lung cancer. So this has been inaugurated by the US Consul General today. Mr. Michael Malus has inaugurated the program, and about 10 international faculty from all over the world, about 20 to 25 national faculty has participated in the program. About 300 doctors from all over the country are attending the session, and this session is going to be very useful for several doctors to understand about lung cancer, how to diagnose it in early stage, various aspects of lung cancer, various surgical options, radiation aspects, and the chemotherapy aspects. So like this, lot of issues will be debated today, and a lot of information will be shared among the delegates and the faculty. So that is the main purpose of this lung cancer meet today, and I am sure the deliberations what our people, the participants have, will have a great bearing on understanding of this lung cancer and to enable the clinicians to treat this cancer in a better way. The lung cancer is one disease, usually it is very difficult to identify in early stage unless you have a routine screening. So we should have an X-ray test, or at least we should have a low dose CT scan to pick up these lesions, or sometimes a sputum cytology, or sometimes we can do a CT scan, CT guided biopsies wherever there is suspicion of the lung lesion. So that is how we can pick up the lesions early. If you pick up the lung lesions early, the curative rates are very high. If in the stage 1, it can almost cure about 80 to 85% lung cancers. But if you diagnose the lung cancer in late stage, majority of the patients we are going to lose within a span of 1 to 2 years. This is an unfortunate situation in this country. One more thing we need to remember in this country is that we always mistake tuberculosis and cancer, because sometimes we think the patient may have cancer, but we unnecessarily treat these patients for tuberculosis for a longer time, and then we lose the precious time, 3 months, 6 months on TB drugs, and then we diagnose cancer by the time cancer would have spread. So that awareness and that consciousness should be there with the patient and with the clinician, that tuberculosis can mimic cancer, or cancer can mimic tuberculosis. So in this country, tuberculosis is a very, very common disease. So you should not assume everything as a tuberculosis. You should do the reasonable test to confirm tuberculosis and exclude cancer before you start any treatment for any masses in the lung. That's very important. Suggestions to the patient: you should stop smoking. Very, very important. Because the person who smokes 30 packs of cigarettes for a long time, he is bound to 30 cigarettes per day, is bound to develop lung cancer. So smoking is the single most etiological factor for lung cancer. So you must stop smoking. And whenever you have persistent cough, whenever you are having cough in blood, then you should suspect that you may have or a chest pain or a hoarseness of voice. These are all some of the symptoms where you should suspect the lung cancer, and then you should try to have the diagnosis at an early stage. Then you should be able to